This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, May 5th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. The World Health Organization is praising the international cooperation of a European Union-led effort that has raised more than $8 billion to fund the development of treatments and vaccines to fight COVID-19. About 40 countries, philanthropic organizations, and individuals pledged donations, including $1 billion from the European Commission, $1 billion from Norway, $800 million from Japan, and more than $500 million each from France, Saudi Arabia, and Germany. WHO Director General Tedros Adhanom Ghebreyesus says, quote, "This virus will be with us for a long time, and we must come together to develop and share the tools to defeat it." The United States was notably absent from any participation in this specific fundraising effort, but a senior State Department official says the U.S. is in the process of providing $2.4 billion in global health, humanitarian, and economic assistance towards the COVID-19 response. Nearly 3.6 million people worldwide have been diagnosed with coronavirus. More than 250,000 have died, but over 1.1 million people have recovered. The U.S. is nearing 1.2 million confirmed cases of COVID-19 and almost 69,000 deaths, according to the Johns Hopkins Coronavirus Resource Center. Turning now to Africa, where the fight against COVID-19 has taken a tragic turn. A plane carrying coronavirus aid crashed in Somalia late Monday, killing all 6 people on board, according to the transport minister. Minister Mohamed Salad says 5 bodies have been recovered. The cause of the crash is under investigation. Meanwhile, Uganda is relaxing some of Africa's tightest COVID-19 restrictions Tuesday, as the country of 42 million reports only 97 confirmed cases and no deaths in 45 days of restrictions, according to President Yoweri Museveni. Uganda had closed nearly all businesses and imposed dusk to dawn curfews. Now many businesses, including hardware shops, restaurants, and wholesale stores, will be allowed to reopen. Public transport and most private vehicles would still remain prohibited. Museveni says schools and borders will remain closed. Nigeria is easing some coronavirus lockdown measures to reduce damage to its economy. Monday action followed weeks of a nationwide shutdown that hurt millions of businesses. Timothy Obiezu reports from Abuja on warnings by critics that easing restrictions could lead to more damage to public health.
Computer specialist Michael Kundun went to work early Monday, hours after Nigeria's lockdown eased. The last time Kundun came to Abuja's Nyanya market was 5 weeks ago. He had some cleaning up to do, but is happy to be back at work.
It's going to be gradual. It's not going to be as it was from the beginning, but by the grace of God, it will pick up. Business will pick up with time.
Nigeria relaxed its 35-day lockdown in Abuja, Lagos, and Ogun states Monday at the order of President Muhammadu Buhari. President Buhari concedes the lockdown has hurt the Nigerian economy, especially on non-essential sectors that depend on daily income for survival, such as Kundun's business.
The lockdown affected my business drastically. In fact, I find it difficult to work. I find it difficult to meet my customers.
The lockdown relaxation comes as Nigeria is recording more coronavirus cases. Daily publicly reported figures doubled in the last week, reaching more than 2,500 on Monday. Critics are denouncing the president's decision.
I'm not happy for the planned relaxation of the lockdown, because if the federal government or the president in particular is having good advisors, I think it is very bad for them at this point in time for them to start thinking about the reopening of the lockdown.
Before easing lockdowns for some areas, authorities have issued new regulations, including an overnight curfew, the mandatory use of face masks in public, and strict social distancing restrictions. But on Monday, thousands across Abuja City flooded marketplaces and banks, and it appeared some were violating those physical distancing orders. Economic analyst Audu Siaka has this warning.
Ghana and Germany tried to ease down and to ease the lockdown, and what actually happened was not palatable, which they quickly reversed their initial decision. So I'm not saying that may happen to Nigeria, but it's likelihood, coupled with our population.
So far, Nigeria has tested 17,000 people for the coronavirus, a very low number when compared to other African nations. While President Buhari has promised aggressive testing and contact tracing in the coming weeks, critics will see if he makes good on the promise. Timothy Obiezu for VOA News, Abuja.
The worldwide coronavirus pandemic is an evolving situation, and while scientists continue to better understand the virus and how it affects people's health, there are still some uncertainties. Many questions remain regarding COVID-19, including how it affects women who are pregnant or breastfeeding and their babies. To find out more, Africa 54 health correspondent Lino Mudu spoke with Dr. Koki Agawal, Vice President of JPIGO, DC Operations, an international non-profit health organization affiliated with Johns Hopkins University.
Dr. Koki Agawal, thank you so much for joining us.
Thank you. It's really great to be back with you again.
How does COVID-19 affect pregnant women? How, in what ways?
So we don't have a lot of studies that demonstrate the impact of COVID-19 infection on pregnant women and newborns. What we do know that there's a lot of changes that are happening in their bodies during pregnancy. So any infection can be a challenge. So women must protect themselves, and with frequent hand washing, social distancing, and respiratory hygiene, like sneezing into your elbow. And if they have any symptoms, they should also seek medical care early. The services that mothers and should continue during this time of pregnancy is that they must be able to receive their routine care and essential services during pregnancy, because we know that this time during pregnancy is the most vulnerable time for women and their newborns.
Now, you mentioned that we don't have much information with this topic for pregnant women. Is it fair to say that the same is true for lactating mothers who are breastfeeding?
There is a little bit more information available, and breastfeeding, if done right, within the first hour of life exclusively for the first 6 months and until age 2, has the greatest potential impact on child survival of all the preventive health interventions that we know. So thankfully now the data that we know is that COVID-19 is not found in the breast milk, and all women are encouraged to breastfeed as per the protocol. And even if their women have suspected COVID or are known COVID-19 positive or have infections, they should do so. They should continue to breastfeed while taking full precautions such as wearing a mask and hand washing before and after touching the baby. And if the mother isn't well enough to breastfeed, she should try and express her breast milk in a safe way, because breast milk confers the best protection that we know for a newborn in the first 6 months of life and beyond.
Okay. Now, what are the essential maternal and newborn services that mothers should continue while there is this pandemic? Because a lot of times you see that some women may be concerned about coming to the health centers, about being infected or being perhaps tested positive. So talk to us about some of these essential services and why it is important that in such a time they still come to the health centers.
So these are important services that women should receive, because we know from our work during the Ebola epidemic that some of these essential services, and I'll talk about them in a minute, were disrupted. And we know from a study that was done in Sierra Leone and modeling estimate that showed that any decrease in utilization of family planning services, antenatal care, delivery care, and postnatal care translated to additional 3,600 maternal and newborn deaths as an indirect impact of Ebola because of disruption. So we know that women should continue to use these services, as I mentioned. They should continue to seek out antenatal care, where WHO has recommended that there should be 8 contacts during pregnancy, and deliver with a skilled attendant in a facility and follow up with postpartum and postnatal care. All women and newborns should stay in the facility for at least 24 hours after birth to receive the necessary health check, counseling, and care before they are discharged. This includes provision of postpartum family planning, counseling, and services, and information on danger signs should symptoms of COVID-19 emerge once they are home. And ministries of health are working to look into some modifications that they would need to do in the way services are delivered to maximize safety during the COVID-19 pandemic.
Health experts say pregnant women experience changes in their bodies that may increase their risk of some infections. So it is very important they follow all necessary steps to protect themselves. It's like standing between life and death. That's how Zimbabwean women's rights activist Betty Makoni describes her battle with coronavirus. Makoni, now a social worker in Britain, says she contracted the virus from a colleague who tested positive earlier this year. Makoni has been isolated in her home since March. She spoke to VOA's Heidi Adams-Fitzpatrick about her ordeal.
Betty Makoni is a celebrated champion of women's rights in her home country of Zimbabwe and where she now lives in the UK. In March, Makoni found herself fighting for breath and her life. She spoke with me from quarantine in her bedroom.
You see my chest just closed on 16 March. It just went, that was it. I couldn't breathe. I called ambulance came and they took a swab. Then they were confirming to me that it must be corona symptoms, but they have to go and find out.
So did the doctors tell you it was better to rush to hospital or stay home and weather it out there?
The ambulance failed. I was not such a case that could be in critical hospital given the situation. I could be managed from home. My NHS 1 doctor was the one who called me to say it's chest infection. So we have to deal with the secondary symptom. I was bleeding, my nostrils. So they said it might be that we have to fight the infection, but you are not a hospital case at all. So I understood why I shouldn't go. It could be worse.
Despite the help of telemedicine, paramedics and self-isolation, Makoni endured a roller coaster of symptoms.
My blood pressure became stubborn. So I lost my eyesight. I had no idea that blood pressure is an underlying symptom. No idea and how it could connect it to a virus. I was on antibiotic. I couldn't breathe well. But then they said I should start cardio exercise. So the mucus, the yellow mucus, one of it came out like a thick. I was scared. What kind of mucus would come out of a human being? It was so thick and yellow. So I started shivering. But then it smelled of blood. I couldn't breathe. Then I called the ambulance. My chest was like, whoo, 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 So at that stage, they told me the virus must be lingering. It's horrifying. You feel death. I felt death. I gave up. There are moments where when I lost my breath the second day, I said, I have lived enough on earth to go. I must go.
Betty, how has this changed you physically and psychologically?
So physically, I am much weaker. I'm much slower. And I think people mustn't underestimate the impact on our bodies, because something we are not sure of was actually taking the better part. I'm a social worker by profession. I'm going to dedicate my life to the mental health of everybody who suffered coronavirus. My message would be, this is the time to prevent. Let's not allow this virus to come. Let's not wait for government lockdown. We will not ask about where it came from. we will ask where it is. So I want every woman to be armed. A lot of social problems are coming as well, economic problems. So we should be ready. It caught us unaware in UK, even in this first world country. The only thing we can do is let's prepare our homes for this. Learn from our mistakes. Most of us died on the front line. We don't want it to happen in the continent. Let's not take this for granted. Let's really take the bull by the horns.
That was VOA's Hedy Adams-Fitzpatrick. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, comedians managed to get laughs from people during pandemic lockdowns. We'll be right back after this break. The recent suicide of a New York emergency room doctor is refocusing attention on the toll the COVID-19 pandemic is taking on medical professionals. Two doctors shared with VOA their struggles to cope with the almost unimaginable burdens they are shouldering and the deaths they have been unable to prevent. VOA's Caroline Presutti has more.
Working at ground zero of America's coronavirus outbreak in New York City, Dr. Ruchita Gandhi doesn't mince words about the battle.
It's like soul crushing what we see on a day-to-day basis in the emergency department. And for my colleagues upstairs in the ICU and on the floors, we are facing an entity that we don't truly 100% understand how to treat it. And that just, it makes it so frustrating because we want to so badly.
We're so busy and there's so many sick patients.
Stress has been Dr. Rotem Freed's constant companion.
It's just hard, you know. Families bring their loved ones to the emergency room and then they may not see them for weeks on end and they sit at home waiting for that phone call or fearing that phone call.
Dr. Freed works at small hospitals in Pennsylvania and New York. Both states are slowly reopening for business.
There's the getting our country back, the economy started again. But on the other hand, I see what we feel at the hospital, which is if we get another peak like this, you know, it's a huge worry of whether or not we'll have equipment and beds and manpower to take care of another surge, a surge on top of a surge.
Freed drives 2 hours each way to work long shifts at Montefiore Nyack Hospital. When she arrives home, she unwinds with hot, disinfecting showers. She admits she's having trouble balancing home life with her husband and 3 children.
It's tough. I won't lie. I won't say really well.
Dr. Gandhi's husband is a psychiatrist who can read her face and knows her mood as she walks through the door.
So sometimes it's something as simple as like, you know, cuddling together on the couch and putting on a comedy on Netflix and like really relaxing music. And I'm not going to really talk about work.
The first-generation Indian American says the successes pull her through, like when she had an end-of-life discussion with the children of a 98-year-old woman. And then something seemingly miraculous happened.
She proved me wrong, and that's a great feeling. I am happy to be wrong. You know, I am very happy to be wrong on these things. Very happy. So that was like actually like a ooh, amazing. Like this woman is a fighter.
COVID doctors cherish opportunities like those to smile under their masks. Caroline Presutti, VOA News.
The coronavirus pandemic has upended the U.S. presidential campaign. What was expected to be an ideological choice between President Donald Trump's hardline immigration and protectionist trade policies versus Democratic challenger Joe Biden's more moderate positions and support for health care is no more. VOA's Brian Pardon explains.
With coronavirus deaths in America numbering roughly 50,000 and millions left unemployed by the economic toll, President Trump has shifted his campaign focus from overseeing an age of prosperity to leading a national recovery.
That's not a strong suit of Donald Trump, and he has been more divisive than uniting in that front.
During the coronavirus crisis, Trump has dominated the airwaves with daily White House briefings that critics say are more often used for self-promotion rather than providing useful information.
Thank you, everybody.
The approach does not appear to be popular. The president's approval rating has been falling in recent weeks as he shifted responsibility for testing to the states, gave conflicting advice on when to reopen the economy, and promoted untested and possibly dangerous treatments like the malaria drug hydroxychloroquine. Medical professionals on Thursday warned against the president's suggestion that injecting disinfectant could kill the virus, calling it dangerous. As some Americans have protested the lockdowns that have closed businesses, Trump encouraged some on Twitter. Days later, he criticized the governor of Georgia for relaxing restrictions too soon.
It's a very common tactic of the president to shift the blame and to try to take credit for the good part and let other people take credit for the downsides.
The president also issued a 60-day immigration ban and has blamed misinformation from China, where the outbreak originated, for the spread of the virus in the U.S. Meanwhile, the approval rating of the presumptive Democratic nominee, Joe Biden, has risen, even though news coverage of his campaign has dwindled and public events have been canceled. That may be his plan.
There is a logic to getting out of the way and letting the president fall.
Analysts say Biden's years of experience in government and in managing the Ebola outbreak during the administration of former President Barack Obama have enhanced his standing.
Given what we're seeing as a window into how the Trump administration operates, that is going to work to Biden's advantage. It doesn't mean that this election is over. It is by no means over.
Trump's political fortunes could turn around before the election if the outbreak subsides and the economy starts to recover. But a predicted second wave of infections and shutdown in the fall could again boost Biden's prospects. Brian Patton, VOA News, Washington.
The White House recent executive order suspending most immigration to the U.S. does not directly impact foreign students, but it has created anxiety and doubts about their ability to stay and work in America after graduation. Here's Aline Barrows.
The education of many international scholars is in limbo due to effects of the COVID-19 pandemic. Add to that, recent graduates who applied for temporary work visas in the U.S. are worrying paperwork will not be processed in time for them to start new jobs. Azam applied for optional practical training, a program that allows participants to work in their field of study for up to 3 years.
So when I apply for jobs, right, it's very much like, I put in my cover letter, like, you don't have to sponsor me. I have work, and I say this, I have work authorization that should kick in June 1st, just because I'm banking on it.
The U.S. government stopped processing non-immigrant visas more than a month ago, since most consular services at American embassies were suspended. And with international air travel also impacted by COVID-19, there's concern how students would get to their respective campuses.
We've been having calls about this and conversations about this for the past month, about whether or not the students that we had admitted for fall 2020 are going to be able to come, and so far we just don't know the answer.
Hamelin says any expansion of President Trump's executive order restricting non-immigrant visas could have a devastating impact on higher education in the United States. Researchers expect a 15% drop in overall student enrollment in the next academic year, including a 25% decline in international students. That could mean a loss of $23 billion in revenue for U.S. colleges and universities.
We can't even offer a remote option for students whose student visa has not been processed in time, because even though they would not be physically trying to enter the United States if they were taking classes remotely from their home country. They can't be an officially enrolled student and take classes for a grade until their student visa has been processed.
For postgraduates, once they exhaust training programs, the next non-immigrant classification for temporary employment is to obtain what's called an H-1B work visa.
They are really going to be shut out, because if you're not able to get an H-1B after your student status expires, then you have to return to your home country.
Students who are unable to maintain their visa status have 60 days to return to their home countries. Alini Barrows and Isha Sarai, VOA News, Washington.
With the coronavirus having closed nightclubs around the world, comedians are still managing to get the laughs from people on pandemic lockdowns all over the world. VOA's Mariama Diallo reports on Hollywood's Laugh Factory and the Stand Comedy Club in Edinburgh.
Laugh Factory owner Jamie Masada started streaming live comedy shows shortly after California ordered all non-essential businesses closed.
We should not forget laughter is healing. Laughter brings people together.
Comedian Tehran Von Garci has been hosting live sets alongside actor Craig Robinson. He says the stream is being played in hospitals for patients infected with the coronavirus.
When I read a DM I recently got from someone in London who specifically said the last memory that they will have of their father is them watching the Laugh Factory live and laughing at Craig and myself discussing British accents. That's going to be something that sticks with me for the rest of my life.
Elsewhere, when the UK government ordered a 3-week public lockdown, the Stand Comedy Club decided to host a live-streamed show with an option for the audience to donate to the club and to the comedians. The experiment has proved a success, with an audience of 100,000 tuning in to watch the first 2 shows. That's compared to their usual venue, which seats 160.
People were watching from all over the world, some people in quarantine, in isolation. People from every continent basically got in touch.
Ross McClellan says doing stand-up without an audience seems odd, but there might be an advantage to it.
I feel like sometimes, right, when I walk out and people hear me speak and the way I look, they get a bit worried, you know, and I get it, I understand. It's the eyes, isn't it? I've got these big eyes in my head.
And finally, the Japanese comedian who stormed the world with his nonsense pineapple pen hit is repurposing the catchy song into a new message. Wash your hands.
I have a handle. I have a soap.
3 days after the song was released, it has racked up over 3 million views on YouTube, and the comedian's Twitter page has been flooded with videos of Japanese children laughing and joining in on his hand-washing dance. Mariama Diallo, VOA News.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.